We're here to release the first ever report in Multnomah County that documents the number of people in our community who died on the streets last year. Street Roots approached us about a year and a half ago to request that the medical examiner start to collect information about those who have died while homeless. This report gives us an opportunity to acknowledge those who have died on the streets. So first and foremost, I want to extend my deepest sympathies to the friends and family of these individuals. While we may not know their names, the details of their death will give us a way to save other lives. This report also gives us an opportunity to learn and to improve. In Multnomah County, the shelters are full, many with months-long waiting lists. The high cost of housing has forced too many people to sleep in their cars and under bridges. And the lack of access to health care, mental health care, and drug and alcohol treatment means many people do not get help when they need it. The outcome of these realities is what we see in this report. In 2011, 47 people, nearly one person a week, died on the streets in Multnomah County. These numbers are not acceptable. This is not what a strong, healthy community looks like, and it's not what we want for the place that we call home. As a county commissioner, my job is to ensure that our community is strong, healthy, and vibrant, and my hope is that this report will help us do that. I want to say thank you to Street Roots for encouraging us to collect this data, to the medical examiners who collected the information, and to the people in our community who will take action based on what we've learned. I want to thank the Multnomah County Health Department, and especially our director, Lillian Shirley, who's with us today. And I want to thank the report's author, Dr. Paul Lewis.
One of our goals was to try to develop a system for trying to track these deaths in a sustainable, efficient way so that as years go on, we'll be able to, at least in some way, judge our progress about addressing deaths among the homeless. That being said, there's some very important limitations that I want to tell you journalists to take into account as you think about reporting this. We think that the methods we used almost certainly result in an underestimate of the number of deaths, and also that the causes of death are going to be a specific subset of all causes of death. So I want to tell you a tiny little bit about that. The data that was accessible to us was from the state medical examiner, and the state medical examiner specifically determines the manner and cause of death of a subset of all deaths. This does include homicides, it does include suicides, it does include suspicious deaths. It also includes drug and alcohol overdoses, and it does include accidents. But what it does not include is deaths of people with medical conditions who were under any kind of medical care at the time of their death so that another physician could certify the cause of death. So that most of the deaths we expect to be found in this report are those that are under the jurisdiction of the medical examiner, as I listed before. And again, we think this is an underestimate of all deaths among the homeless. The second important thing about the methods that we think leads to an underestimate of the total is that it was through the efforts of the medical examiner and the deputy medical examiners that they flagged records of those for whom during their investigation they could not determine a place of residence. They were domicile unknown. Now, the deputy medical examiners have to do 3 to 5 of these per day, so they're working pretty fast. They gather as much information as they can. The records that they flagged, we further reviewed all of the data and all of the narrative that they found, and we only included those that clearly met the current HUD definition of homelessness. So we feel very confident that these 47 people are indeed experiencing homelessness and meet the current HUD definition. We do have concerns, however, that we didn't have the capacity to review every single medical examiner death, and if someone appeared to have a residence or housing at the time of the death, they may not have been flagged. So again, this is another underestimate that we think we're dealing with. That being said, the results in the report, I'm just going to touch on very, very briefly. There was a wide range of ages, 18 to 68 years of age. There were more men than women, and there were many different races and ethnicities among this group. It's really important to note that the largest group of deaths are from accidents. And again, those of us in public health always think about accidents as things that are being preventable. And indeed, all of the accidental deaths are, in principle, preventable. The accident category in general, and in this report in particular, includes really two subcategories, and that's trauma and drug or substance overdose of one kind or another. And the final thing, and it is mentioned in there, I just want to highlight it, is that we specifically just describe the numbers of what we found. We didn't attempt to do any further analysis, find any other associations, or calculate rates, or compare ourselves to anybody else. And that's because we didn't think it was scientifically valid given the limitations of the data. Nonetheless, we think it's still an important first step for us in trying to track this problem.
Street Roots has been working with people experiencing homelessness for more than a decade now, and throughout that time we've watched and witnessed many people who have passed for many different reasons on the streets, both people that were documented that would fall under the medical examiner's privy of the current deaths, and also people that die with just basic ailments out there in the streets every year. And so many people experiencing homelessness, it's such a traumatizing experience for people to survive day in and day out. Many of the individuals that we work with are constantly living with walking pneumonia, with just the basic flu and cold symptoms that when you're sleeping out under a bridge or in a doorway can be very detrimental to people's health. And so this, we feel like, is a first step in being able to have a larger conversation as a community to be able to really talk about how healthcare providers, government, nonprofits, the private sector can really work together to create a really streamlined approach to being able to do targeted services for people on the streets. I also just want to say that, you know, in these tough budget times, that it's very important, I think, that we take into account that the decisions we make as government and as a community are so crucial because people's lives are at stake. And while we are a great city upon a hill with great innovators and creative thinkers and sustainability and so many things that make the city of Portland and Multnomah County great, we have to be able to put housing as a priority, because at the end of the day, housing really is an opportunity and will save lives in our community.
The conclusion in this report is that last year, on average, once a week, someone died on our streets, and that death was preventable. That is shameful. And so today is a call to action. And each of us have a role to play: government, faith community, business, and nonprofits. Here's what I'll commit to do. We must, as a community, continue to invest in success. Long-term, cost-effective strategies to end homelessness, and that means we must insist on marrying services with homes and providing clear pathways to self-sufficiency. Second, at every level of government, we are going through a painful budget time. At the city, we have dramatically reduced revenues to meet increasing needs. I commit to fight tirelessly with the coalition that has been assembled to protect $4.8 million of one-time funding for our safety net. Our most vulnerable residents are depending on us, and now is not the time to turn backward. And third, I will commit with my friend and colleague Deborah Kafori to make sure that every dollar that comes into this system, whether it first comes to the county or the city, is spent wisely. We will have fewer resources going forward to meet a growing need. As a result, the partnerships between and among government must be stronger than ever. What gives me some hope this morning as we consider this horrific data is that we have leaders and champions at every level of government ready and willing to redouble their efforts to end homelessness, and I'm honored to be part of that team.